Okay, hey guys. So again, we will have online lecture today, and then Thursday we'll pick up in class and we'll have a lecture. Thursday is going to be a little complicated due to we have projects that we have not picked up on. So the advocacy project, people not being in class last Thursday, really threw everything off. So we will do advocacy projects Thursday very quickly. And then you also have a consumer project that we're going to present on Thursday as well. So make sure that you are paying attention to those things on the calendar. I posted that online Blackboard for you in week 12, so your consumer project is going to be based on that chapter. So really what I'm hoping is that the consumer projects will take up a majority of the class because that's what I really want to spend time on. So the project is going to require you to pick at least a minimum of 2 different products, and the products have to be health related. So anything that you encounter on a day-to-day basis, so it has to be of the same category. I gave you an example of soap on Blackboard. That's not exactly health related. I can understand how it could be, and if you want to use soap, then that's perfectly fine with me. They use laundry detergent. I do believe they pick 4 different laundry detergents and do research on them. Some examples I gave you just for products were toothpaste, condoms, some other ones could be health related food things like cereal, Kashi, between Honey Nut Cheerios. But you get my drift. It has to be the same category, whether it's laundry detergent, condoms, cereal. All of those are categories, and then you pick different products within those categories. So the example of the laundry detergent, they picked like Tide, Gain, and then like OxyClean or whatever the other product is. So I mean, you could pick, if your topic was cereal, you could pick Kashi, you could pick Honey Nut Cheerios, you could pick whichever one. They advertise those things to say that they're healthy, but are they really? That's really the question of the matter is it really healthy? As they are advertising, is it really what they're selling? Is it really what they're portraying? All of those things. So that's really the big question. Is I really want you guys to be good consumers. I want you to question what they're selling you. Is it beneficial? Is it, again, is it good for you? Are you just buying it because it says it is and you're not questioning it? I want you to question things. I want you to think, where'd they get their information from? They're telling me it's healthy, but I'm not sure it's healthy. So that's really what the project is about, and that's the nitty-gritty of it, is what I really want to get at on Thursday. So there's a place in there for Blackboard. It's not due ultimately until Sunday, but again, I really want you to be able to present on it. So what you can do is you can at least do your poster board or PowerPoint and then do your summary on Sunday. So there are 2 pieces. So you can do a poster board or a PowerPoint. I'd really like to see poster board, but I understand that's a little bit of an outdated type of way to present, but I like the visual aid of that. So that would be my preference. If not, PowerPoint is okay. We'll do those on Thursday, and then you can write your paper, and that's due on Sunday. That's just the way that we'll do it. So you do have to have something to present on Thursday, and it is individual. Okay, so getting down to the nitty-gritty of what we're going to talk about today, which is chronic diseases. I was hoping to be able to do this in class with you guys again last Thursday, but that did not pan out. So chronic disease is a very big discussion, and it's a very large chapter. There's a lot of material for us to talk about and cover today, so please bear with me. So cardiovascular disease is the first disease that I really want to talk about, and it is considered to be any disease that affects the blood or the heart. So it could be blood vessels, blood, or the heart, or both. And cardiovascular disease is the #1 killer in the United States, actually. Over 80 million Americans have some form of CVD, which is the acronym for cardiovascular disease. CVD is responsible for every 1 in 3 deaths in the United States. And again, it's the number one cause of death all around, even above cancer or anything else. A projection that I found by 2030, over 40% of the U.S. is projected to have some form of CVD. So cardiovascular disease is a big blanket for all of the other cardio diseases like coronary heart disease, coronary artery disease, all of those go under cardiovascular disease. So I just mentioned this, so types of cardiovascular disease. So stroke is actually the most common form of cardiovascular disease, which is hard to believe sometimes, I know. So again, coronary artery disease, a stroke, peripheral artery disease, high blood pressure is a type of cardiovascular disease, that's hypertension, and heart failure. All of those are different types of cardiovascular disease, and we're going to cover a little bit of each one of those. So coronary artery disease is obviously a disease of the arteries. So it's buildup of plaque inside of the arteries, and it causes a disruption in flow, and when there's a disruption in flow, it tends to be a little harder to get blood to pump through the heart, which causes a little bit of pain, especially when the plaque buildup reduces the elasticity of the arteries. So the most common form of coronary artery disease is atherosclerosis, which is the buildup of fats. Like I was saying, it's the buildup of fats in those arteries, so fat, cholesterol, and lots of other waste products that go throughout the body line the arteries. So they all line the arteries, and they typically begin in childhood, so all of that Bojangles, Cookout, Burger King, pizza that you're eating can often stay with you from childhood to adulthood. That's why they tell you that diet is so important early on in life, because if you're eating those things, you can't sustain that through a lifetime. The plaque builds up in your arteries, which can worsen as age develops. Excuse me. Excuse me, guys. I'm sorry. I'm not feeling the best today. You can probably tell. So I do apologize for that. So that can typically worsen with aging, struggling. And then that can lead to artery sclerosis. And artery sclerosis, you really, not that you want any of these things, but that you really, really want to avoid that. So what happens is with artery sclerosis is that your arteries harden and they lose the elasticity, and when that happens, it becomes painful. So you lose the elasticity, which does not allow the vessels to stretch, so they can't stretch with blood flow, they can't increase blood flow. So your vessels are elastic and they stretch and de-stretch with blood flow. So if you're working out or you're sending blood flow to different places, then your arteries and your vessels stretch to accommodate for that blood flow. And then whenever they can't do that, then it becomes a little painful. You feel that tightness in your chest, and you feel like it's really hard and difficult for you to breathe. So coronary artery disease results. What happens when you have coronary artery disease? So the first thing, or one of the things that can happen, is angina pectoris, which leads to chest pain. Like I was talking about, those arteries harden and it leads to chest pain. That's just reduced blood flow. So whenever you reduce blood flow and you can't get enough blood flow to the heart, you're going to have chest pains. That's just the way it goes. You can't have, there's no other result from reduced blood flow. Pain occurs with exercise, so again, you're not getting enough blood flow. Those arteries are hardening and it hurts. Then you have pressure, squeezing, chest pain that also radiates to the shoulders, arms, neck, jaw, or back. So again, blood flow. If you have restricted blood flow, it's really hard for you to do anything. Your body's constantly trying to send blood flow to working muscles, and when that deteriorates, then you're going to slow down and you're not going to be able to do as much. So that's typically results of coronary artery disease. Another result could be a heart attack, which is myocardial infarction. That's the special name for a heart attack. Blood supply in one of the coronary arteries of the heart is blocked, which is not a good thing. It deprives the heart of oxygen, so you're either depriving the body of oxygen or you're depriving the lungs of oxygen, because the coronary artery disease sends oxygen. So one sends blood in, one sends blood out. So you really don't want to restrict the coronary arteries because those are the main arteries of your heart, and that's bad news. You really want to avoid that. Heart attack, you really want to avoid in general. You really don't want a heart attack. Then what's typically more common is arrhythmia, which means that your heartbeat is a little off. You have an irregular heartbeat. A lot of people have irregular heartbeats. Some types are harmless. Most of the time they're pretty harmless. Others prevent the heart from pumping blood effectively, which causes cardiac death. So arrhythmias can mean that the blood isn't pumping properly, so you might want to get that checked out. Okay, so we were talking about a stroke and how that's the most common form of cardiovascular disease, so it's appropriate for us to talk about a stroke here. So stroke is defined as the interruption of the blood and oxygen supply to part of the brain. So when we lose blood supply and oxygen to the brain, then we risk going brain dead. So when we cut off that supply, the brain can only survive for so long without cutting everything off. So typically what happens when you have a stroke is that blood supply and oxygen are cut off by a blocked artery or a ruptured blood vessel. So we have arteries that are connected from our heart and our lungs that go up into our brain, and those blood vessels in our brain can also rupture, causing a disruption in oxygen and blood flow, which can also cause a stroke. Stroke is the number 3 cause of death in the United States and the leading cause of serious disability. So stroke is a big deal. Again, the brain is a very fickle creature, and this isn't a psychology class, it's not an anatomy class, so we haven't discussed the brain very much. But once you restrict blood flow to a certain part of the brain, it really only takes a few minutes for that part of the brain to become damaged. So when you have a stroke or you have something like that happen, you have to act fast. There cannot be a delay, because if there's a disruption in the blood flow, a lot of things can go wrong up there. So you have 2 different types of stroke. You have ischemic stroke, which is an artery supplying blood to the brain, which is blocked through a blood clot. So we have a lot of blood clot issues up there. And then what we were talking about earlier is the atherosclerosis is the most common cause. So when we have a disruption in blood flow, again, is the most common cause of ischemic stroke. Then we have I'm struggling with this. Hemorrhagic stroke, a blood vessel burst, causing blood to leak into the brain. So that's typically, you don't have a blood clot or you don't have anything else. It's typically what happens is you have a blood vessel burst in the brain. And this is really typically where you have to be very, very careful, because some people are born with or develop blood vessels or defects in blood vessels that can cause them to have a stroke this way. So again, you really want to be careful with things like that. If you think that you might have this issue, then you really need to see a doctor. Transient ischemic attacks, those are mini attacks, so they are temporary blockage. So you have a temporary problem for one of the more arteries in the brain, doesn't typically cause lasting damage, but is a warning sign for a full-blown stroke. So you have a little bit, so you maybe have a temporary blockage somewhere, and you have a very mini attack, you have a very mini stroke. Sometimes you'll hear doctors say a mini stroke, and that is a very strong indicator that there's a full stroke coming soon if you do not get that fixed. So again, your body tells you what's wrong, you just have to listen. Peripheral artery disease, so that is damage or function of arteries in the limbs, mostly in the legs. So you have blood clot in the legs. A lot of time you'll hear about people having blood clot in the leg, which is again caused by the atherosclerosis. You have reduced blood flow, like we were talking about earlier. Is reduced blood flow to the limbs causes leg pain, leg numbness or weakness. You can't feel your legs, coldness or paleness of the limb, and then you kind of go limp. Untreated, you can lead to tissue death, which can lead to amputation. And then there's also an increased risk of heart attack or stroke whenever you have blood clots in your legs. So when you're in the hospital, if you've ever seen anybody in the hospital, they will put these nice little leg massagers on, especially after surgery, which distributes the blood flow throughout the legs, which pushes the blood back up. And especially if you're at risk for a blood clot, they'll do that. The blood clot can move. So blood clots can move anywhere because, again, if you think about it, blood is continuing to flush through there, so it's pushing it somewhere. And it can push it up or back down. So typically blood will push the blood clot from the legs up, and they're afraid that the blood clot will push up into the lung or the heart or the brain, which is definitely bad. You really have to avoid that. High blood pressure, everyone's heard of hypertension. So the force of blood pushing against the walls of your blood vessels, that's blood pressure. Systolic is the top number. It's usually the average, or where you want to be at, is 120/80. So systolic is that number on the top. It's the higher number. It's the force of blood pushing in the vessel walls during the contraction of the heart. So this is the force of blood pumping through the heart. So naturally that number is going to be higher because it's working harder. It's pushing something somewhere. And then the diastolic blood pressure is the bottom number, which is the force of blood on the vessel walls at rest. So it's not pushing anything, it's just the force of the blood going through there when it's not pushing. So it's the lower number. So you naturally want that number to be low. If any time it's reversed, you might want to make sure that you have your numbers correct and you're doing it properly, or you need to see a doctor. High blood pressure typically means that your heart is having to work harder, or you have anxiety about something, so you get anxious and your blood pumps faster because your heart is pumping faster. Your heart rate increases, which typically means blood pressure is going to increase. If you are physically fit, then your blood pressure is probably going to be lower because your resting heart rate is lower. And if you have a super low blood pressure, the lower that number is, typically that means that the body's not sustaining, and that typically means that, especially if you've seen someone in the hospital and they're not doing well, their blood pressure is really low. Anytime this happens, that typically means that they are, I don't want to say they're on their deathbed, because that's not a very happy way of looking at it, but it's accurate. So blood pressure lowering is not a good sign. When they say that somebody's in the hospital and their blood pressure is good, their heart rate is good, you're good. Those are two very good things that you want to hear with someone in the hospital. If they tell you their